For me, success is determined on a daily basis by the results my patients have from their operations. I'm Clint Marlar. I'm a general surgeon with the Surgical Clinic in Nashville, Tennessee, and I practice at TriStar Southern Hills and Skyline Medical Centers. I grew up in Mississippi and I moved to Nashville in the early 90s to go to college at Vanderbilt. I stayed for medical school and residency training, and then I joined the Surgical Clinic in 2009. I've been working in Nashville as a general surgeon since then. I didn't realize I wanted to be a surgeon until I was in the OR for the first time as a medical student, but it was immediately apparent that that's where I was meant to be. Surgery was probably the most challenging and most meaningful work that I could do, that I enjoyed and I was also good at. I'm primarily an abdominal surgeon. That means on a day-to-day basis for elective cases, I'm usually operating on the GI tract or the abdominal wall, doing all sorts of hernia repairs. The most common operation I do is probably a cholecystectomy, which is removal of the gallbladder. I'd also do quite a bit of minimally invasive colon and rectal surgery. I treat reflux disease, repairing hiatal hernias. I would say the area of surgery that my patients have benefited the most from robotics has been colorectal surgery. The smaller incisions also have the benefit of less post-operative wound complications like infection or fluid collections or patients developing hernias after the surgery. It allows me to perform some pretty technical procedures, some complex operations, even in a more precise and skilled way than I can with an open surgery. I often meet patients with recurrent giant complex incisional hernias after multiple failed operations, and they've been told by other surgeons that they don't have any surgical options left. For most of them, we are able to improve their health, reduce the risks, and come up with a plan using some advanced techniques of abdominal wall reconstruction to give them a good long-term result. I try to treat every patient like they're my only patient, which means I specifically prepare for individual operations, looking at the patient's unique anatomy, if there is any, reviewing their imaging, and come up with a unique plan for that patient's care. It also means that I give every patient my complete focus and attention on the day of their operation, and I'm completely available for them after surgery. Most of my patients go home after surgery. A large volume of what I do is outpatient surgery. I'm always available for patients on the phone, in the office. They can come anytime. They usually have a scheduled post-op visit, and we see them back and make sure they're doing well, and hopefully it's just one post-op visit if they do well. Patients who stay in the hospital, I see them every day, sometimes twice a day, checking on them before I go home and making sure that things are going well. Communication is one of the most important things for ensuring good health care for patients. It benefits us and the patients, makes my job more enjoyable. I am very collegial. I like to collaborate with other healthcare providers. Everyone has my cell phone. Looking ahead, I just want to be a better surgeon tomorrow than I was yesterday. I believe in lifelong learning and continual improvement, both on a personal level and a professional level. What I get to do every day is a privilege and a responsibility. I'm grateful for the opportunity, and I do everything I can to make sure my patients have the best surgical care they can get.